Hi, everybody. Thanks for joining us today. We're so excited that you were going to tune in. Unfortunately, we had some technical difficulties, so apologies that this is a recorded session instead of us being live with you. Just to give you a little bit about what we're going to be talking about and a little bit about who we are in case you haven't, in case you don't know about the Children's Attention Home or you haven't looked us up before. The Children's Attention Home provides a safe and nurturing home for abused and neglected children. We serve children in foster care as well as homeless youth ages 17 to 20, foster care ages birth to 21. And we've been around for almost 50 years, making sure that these kids have a safe and nurturing home here in our community. So we partner with DSS as we're licensed through them. And so that's how we serve children in foster care, how they're placed with us. And so we serve children here in York County, but we also serve across the state. And so today what we're going to be talking about is Child Abuse Prevention Month. And especially right now, given the climate of where things are, it's so important that we are all aware of the ins and outs of the child welfare system, the state of where things are as we experience the coronavirus and the effects that it has on our community. And so I have a couple of people here with me today that I'm excited to have join me. I have Kathy Bolduc, our social worker here at the home. Kathy has also been an investigator with North Carolina Department of Social Services and is one of our trainers for mandated reporting. And then Emily Parrish is also joining us, and she's our executive director and has been with the home for over 15 years, and so has a breadth of experience in working with not only our kids and what we see here at the Children's Attention Home, but also in working with providers across the state. So thank you both for being here today. I know everybody's going to enjoy hearing your thoughts on these topics. So first, I wanted to kind of go into what the state of child welfare is right now and some of the concerns that each of you have as it relates to just the changes that we've seen with the coronavirus and the restrictions that have been put in place. So what are the concerns and the issues that you see in child welfare right now?
Thank you, Katie. I think it's just such a scary time for everybody. I think it's a high stress time, and so that makes us worry about the kids that are at home. We have a whole network that exists for our vulnerable children and folks that need help, and the idea that they can't get to resources that they may need, that they can't communicate if they're at risk or in a bad situation, I think is really frightening for all of us. You've got folks at home without access to schools and teachers that are there to sort of see if something bad's going on and help them. You've got folks who are worried about finances. You've got folks who are worried about keeping their jobs. You've got folks who are working and are worried about bringing home illnesses and things like that to their families. And so it's just when things are high stress, when things are turbulent like that, it leads to higher instances of child abuse and neglect. And so I think we're just worried about the impact that we're going to see overall on the children in the community.
Thanks for sharing that, Emily. Kathy, do you have anything to add?
Yeah, absolutely. I think it has made a very negative impact on our current foster care system. They're having things like virtual visits, and a virtual visit is when your family member, caregiver who you've been removed from, you're now going to see them over the internet, on a computer. You really can't replicate that, a regular visit with, hugs and touches and love. And so it really puts this just really difficult way to even visit with your family if those things are happening. They may not even have the technology for this. Caseworkers, I've read a lot of things about caseworkers are scared out in the field, not having enough personal protection for them. Also, I had one of our residents that came, up to me and was just distraught about her court date. It's been moved. And that's a story of, there's 1,000 people out there, with the same story. Your court date's put off. She was hoping that she would be able to reunify with her family. And now she doesn't know when that's going to happen. I've had other kids who are now, now have been in custody over a year. And this is adding even more stress on top of that, knowing that that is going to be longer for them to have, a long-term placement.
Yeah, I know that you and I had spoken a little bit in more detail about those particular stories. But I think, what would be helpful for people at home is, what can I do about it? I know that it's really easy with child abuse and neglect to feel a little helpless and a little lost sometimes as to what can I do that's actually going to make an impact. And I know that for us at the home, we're taking a lot of steps and doing a lot of things in order to, take the best care that we can of the kids right now, make sure that we are listening, that we're there for them, that we're keeping them busy, distracting, for lack of a better word, just to keep their spirits up and making sure that we're creating a positive environment. So I know, though, that, for those that are potentially in harm's way, Emily, like you were talking about right now, there are steps that people can take in order to mitigate some of the things that we're seeing right now with teachers not being present or kids not being in daycare, those seeing, the kids on a regular basis outside of the home. How can somebody help these kids right now in this situation, even though we're socially distancing?
I think we have to be more vigilant to pay attention to what's going on in our neighborhoods and, in our communities. I think, it's tough when we're not able to have those close connections. And so I think we have to listen, and I think we have to look out, and if something feels different or feels off, then that's where, we have to go with that instinct and that feeling. I think, we have to check in on our neighbors and talk to them. And, if folks seem like they're struggling, or, kids seem like they don't have what they need, or they're in a bad situation, then that alone, that's enough for us to start to make the call, and at least start checking in on folks and making sure that everybody's safe.
Yeah. Kathy, do you have anything to add to that?
Yeah, I just want to talk a little bit about, just touch on what a mandated reporter is. That certain professions are required, you have to be at least 18 years of age to make a child abuse or neglect report. Those professions, there's a long list. I think we're going to add some more information, resources for you on our, on the page. But, those are things like doctors, teachers, nurses, social workers. And as we talked about before, the children, they're not seeing those people who are those mandated reporters on a regular basis now. They're home with their families or home with their caregivers. So I think that anybody, I want people to understand that anybody can make a report. This piece is entitled "See Something, Say Something," and that is really important. And it's not hard. It's not scary to make a report. It's easy to do. It's picking up the phone. You don't have to have a lot of information. You don't have to be, to over investigate anything. If you just have a little bit of concern, a gut feeling about something, like Emily said, then absolutely you should report it and tell somebody, and then the Department of Social Services, they will get them the services that they may need.
Absolutely. And I know, as we were preparing for this call, some of the things we were talking about, just the way many folks may not know how the system works. And so, once you call to make a report, there's a lot of ways that child welfare is helping these kids make sure that, making sure that they're in a safe place and that they're taken care of. So just because you make a call doesn't mean you've removed a child from the home. I think that's important for people to know, that it's not your role to make the determination whether or not home is a safe place. It's your determination to make sure that, if you see something or you hear something or you're concerned, that you're reporting it, so that those who are trained to determine what the best next step for those kids are can do their job. And so it may be that an investigation is unfounded, meaning that, they're not removed from the home, or the family needs help and they get them the resources that they need. It can also mean that the family preservation services come in, so there's extra supports placed around that family. It can also mean that the child, if safety is a concern, that the child may be removed from their home in order to be placed in a safe and nurturing home, whether that's a foster family or someplace like us. And so I think, like you said, Kathy, it can feel scary, but it's really not. It's doing our due diligence as citizens. And so talk a little bit about right now, while we're socially distancing, or physically distancing rather, what are some of the ways that we might be able to recognize when something might be off, or that some of the ways that we would typically notice are not the same? And so can you speak a little bit to that?
Sure. I think that if you see something as common as, an injury, you might see something that seems unusual. Or if someone just tells you something over the phone, or you're in a walk in your neighborhood and you see something that doesn't feel right, something that looks like neglect or abuse in your, in your heart, then that's when you should make the call.
Absolutely. Is there anything, what are some of the things that, while we're socially distancing, is there something that we can be doing, since we're not physically with a lot of people, that maybe would help us recognize when something that is going on doesn't seem right? Emily, do you have anything to add to that?
Yes. Again, I think like Kathy's saying, when you're out in your neighborhood, when you're engaged with people, no matter how far away, I think using whatever resources we have, right? And we can call folks, we can check in. We can see if things look different or things look the way that they're not supposed to be. And again, just like you said, we're not the ones doing the investigation. All we're charged with doing is, if something seems off, if something seems out of place or seems weird, or gives us a bad feeling, then all we have to do is make the call. And there are folks that is their job, to follow up and to make sure everybody's good and everybody is safe. And so I think we have to be on the lookout for our neighbors and the kids, to make sure that things are the way they're supposed to be.
Yeah. So we're going to shift gears a little bit. And as Kathy mentioned, we will be putting resources for how to report, maybe even some of these signs to look for. We'll be putting some resources on the page with this recording, so that if you have had questions, or you're looking for more information, hopefully those resources are helpful. So apart from making a report, there's also the flip side is, how do we prevent child abuse from happening in the first place? And there are a number of reasons, Kathy, and you mentioned them earlier, that just the state of the world right now and the environments that we're in, some of the effects of the coronavirus and the social isolation everything has caused. It's important that we're coming alongside people and we're being good neighbors, So can you talk a little bit about being a connection and how we can be on the front lines, not in the sense of, not just reporting when we see something, but how can we prevent this from maybe even happening in the first place?
Prevention is the one key. I think you mentioned helping people. I think that, well, first we have to keep ourselves. We have to keep ourselves healthy. We have to keep a positive attitude. We really have to keep a spiritual setting that you feel that you can help people first. So it's taking care of us, taking care of yourself. And then it's being a connection for other people, checking in. Even the healthiest of families in this really kind of very scary, unnerving time, those families are struggling as well. If you know someone that has anxiety or depression, or that's something that they've had before any of this was taking place, history of substance abuse, if they've been involved in the system before, checking in with those people, asking them, is there anything that you need help with? What can I do? Can I just offer, some positive words? Do you need, food? Is there something that your kids, are missing and I have, and I have it and I can help you with that? Some things, we've seen some really beautiful things, out in the where we've seen, teachers, packing lunches for kids, because, the kids are not at school and they usually receive like a meal at school. And, those workers are packing lunches and delivering them. I know I had a lady in my neighborhood that started like a tab at the local bagel shop. And so if someone needs a meal, they need a breakfast or a lunch, then they just use her name, and it's anonymous. She doesn't know who she's helping, and it's a very selfless act. And a local pizza place was making $5 pizzas that you could donate, and they would deliver, no questions asked. So there's so many small ways that we can help, and being that light for people, helping them through this difficult time, and just doing what's right.
Emily, do you have anything to add to what Kathy said?
I think she's exactly right. I mean, this is the time above all other times that we have to look out for one another, and that, if somebody needs something, they need to feel like they can reach out and that they have an avenue and a place to turn. And so I think just being there for one another, that's huge. That's what's going to get us through all of this.
Yeah, agreed. So the other way that you can help, in addition to showing up for people when they need us, is raise awareness. Not everybody is aware that child abuse is happening in their backyard, in our community, all around them, and making sure that you are communicating to people that you know. This is Child Abuse Prevention Month, April Child Abuse Prevention Month, and so we've got a number of ways that we've posted on our Facebook page, and we'll be updating our website here shortly, with ways that you can spread awareness, whether it's in your neighborhood, in your connections on social media. Plant a pinwheel garden. Blue pinwheels are the national symbol for child abuse prevention. Put a sign out, that talks about being a connection, or let me know if you need help. Again, supporting our families and our kids where they need. Having healthy conversations. Does that look like maybe your kids are struggling right now, maybe somebody else's kids are struggling right now, or adults are struggling, and like Kathy and Emily have said, just picking up the phone and calling and being that listening ear for the time being, asking them what's happening instead of particularly with kids, being more accusatory or blowing over something that might be really more deep-seated and something that they need to discuss. There are ways that you can help the home right now, and so if you're looking for ways to give back, in addition to supporting your neighbors, we certainly have ways that we could use support in terms of meals, or for those that have the capacity right now, any financial gifts. Certainly seen an increase in costs because of everything we're experiencing. And so if you're looking for a way for your family to give back and support the kids that are struggling right now, you can go on our website and we have all of those posted. And so, if you have any questions, we would love to connect with you. Either comment on our Facebook page, send us an email, info@attentionhome.org, or go to our website, attentionhome.org. We would love to connect with you, answer any questions. And Kathy and Emily, do y'all have any final thoughts?
I just wanted to share a quick story, because they know, I love my stories. I went to the grocery store, which has become a very interesting world in itself. And the lady, the cashier, we had a really nice conversation, and we were talking about groceries, and it was just really pleasant. And the guy who was doing the bagging, he looked at me when I left and he says, "Stay happy." And I thought it really kept me going, like that, stay happy. So just words of positivity and anything that you can do to hold on. I think that's really important. And that's important for our families out there that are, that are struggling, and they need that positivity.
Mm-hmm.
Absolutely. I think knowing that there's somebody else there, knowing that there's a helping hand, there is help out there, there is assistance. And so, I think getting that word out, just like you said, is huge, and letting folks know that there is somebody somewhere that they can connect with, regardless of their circumstances. I think that is so important all the time, but especially right now.
Absolutely. And I mentioned how people can help, but if you are somebody who needs help, please don't be afraid to reach out. There's no shame in it. There's nothing wrong with it. Please make sure, if you need support, that you're getting the help that you need. Well, thank you guys for joining me today. And
thanks, Katie.
Thank you,
all of you that tune in, thanks for listening, and we will talk to you soon.
Thank you. Bye.
Thanks.